CEN Test Prep Exam Booster. Question 1. The initial treatment for a patient with acute esophageal variceal bleeding includes: Option A, immediate surgery. Option B, endoscopic variceal ligation or sclerotherapy. Option C, observation only. Option D, oral proton pump inhibitors. The correct answer is option D, oral proton pump inhibitors. Endoscopic therapy is the definitive treatment for active variceal bleeding. In this rotation, D is the correct position. Question 2. The most common complication of peptic ulcer disease is: Option A, gastric outlet obstruction. Option B, perforation. Option C, hemorrhage. Option D, malignancy. The correct answer is option B, perforation. Hemorrhage is the most common complication of peptic ulcer disease. In this rotation, B is the correct position. Question 3. A patient with meningitis has a positive Brudzinski's sign. The nurse observed: Option A, pain with straight leg raise. Option B, involuntary hip flexion when the neck is flexed. Option C, inability to extend the knee with hip flexed. Option D, dorsiflexion of the great toe. The correct answer is option A, pain with straight leg raise. Brudzinski's sign is involuntary flexion of the hips and knees when the neck is passively flexed. In this rotation, A is the correct position. Question 4. The nurse has an ethical duty to report which of the following? Option A, coworker taking an extended lunch break. Option B, a coworker observed verbally abusing a patient. Option C, the charge nurse arriving late. Option D, the kitchen running out of a food item. The correct answer is option A coworker taking an extended lunch break. Abuse, whether witnessed or suspected, must be reported immediately. In this rotation, A is the correct position. Question 5. A patient with severe pancreatitis has a nasogastric tube placed. The primary purpose is: Option A, nutritional support. Option B, gastric decompression to relieve vomiting and decrease pancreatic stimulation. Option C, medication administration. Option D, diagnostic testing. The correct answer is option A, nutritional support. NG suction reduces gastric distension and pancreatic stimulation. In this rotation, A is the correct position. Question 6. In a multiple casualty incident using START triage, a patient with RR30/min, no radial pulse, and who does not follow commands is tagged. Option A, green, minor. Option B, yellow, delayed. Option C, red, immediate. Option D, black, deceased/expectant. The correct answer is option B, yellow, delayed. RR greater than 30 and altered mental status are red criteria. The presence of a radial pulse is positive but does not downgrade. In this rotation, B is the correct position. Question 7. The initial treatment for acute angle closure glaucoma includes: Option A, observation. Option B, topical beta blockers, alpha agonists, and osmotic agents to lower IOP. Option C, antibiotics. Option D, corticosteroids. The correct answer is option D, corticosteroids. Emergent lowering of IOP with medications and possibly laser iridotomy is required. In this rotation, D is the correct position. Question 8. The nurse is caring for a patient post-TPA for ischemic stroke. The BP suddenly rises to 210/120. The nurse should: Option A. Administer labetalol as ordered and stop TPA if still infusing. Option B. Continue monitoring without intervention. Option C. Administer more TPA. Option D. Administer hydralazine. The correct answer is option A. Administer labetalol as ordered and stop TPA if still infusing. Severe hypertension during/after TPA increases hemorrhage risk. It must be aggressively managed. Question 9. A patient with cholecystitis is being evaluated. Which laboratory finding is most consistent? Option A. Elevated amylase. Option B. Elevated lipase. Option C. Elevated alkaline phosphatase and bilirubin. Option D. Decreased WBC count. The correct answer is option D. Decreased WBC count. Elevated alkaline phosphatase and bilirubin suggest biliary obstruction. In this rotation, D is the correct position. Question 10. The most common cause of airway obstruction in an unconscious patient is: Option A. Laryngospasm. Option B. Foreign body aspiration. Option C. the tongue. Option D. Mucosal edema. The correct answer is option D. Mucosal edema. In an unconscious patient, loss of muscle tone allows the tongue to fall posteriorly. In this rotation, D is the correct position. Question 11. The Levine sign, a clenched fist over the sternum, is associated with: Option A. Pericarditis. Option B. Myocardial ischemia. Option C. Aortic dissection. Option D. Pulmonary embolism. The correct answer is option B. Myocardial ischemia. Levin's sign is a classic descriptor of the substernal pressure sensation of myocardial ischemia. Question 12. The most reliable echocardiographic sign of cardiac tamponade is: Option A. LV hypertrophy. Option B. RV diastolic collapse. Option C. Aortic stenosis. Option D. Mitral valve prolapse. The correct answer is option D. Mitral valve prolapse. RV diastolic collapse is the most specific finding. In this rotation, D is the correct position. Question 13. When receiving a verbal or telephone order in an emergency, the nurse should: Option A. Carry out the order immediately without verification. Option B. Write it down and read it back to the provider for verification. Option C. Ask another nurse to take the order. Option D. Refuse to take verbal orders. The correct answer is option D. Refuse to take verbal orders. The best practice is the write down, read back process to verify accuracy. In this rotation, D is the correct position. Question 14. A patient with a kidney transplant presents with fever and graft tenderness. The nurse suspects: Option A. Routine post-operative pain. Option B. Urinary tract infection. Option C. Acute rejection. Option D. Muscle strain. The correct answer is option A. Routine post-operative pain. Fever and graft tenderness in a transplant patient suggest acute rejection. In this rotation, A is the correct position. Question 15. The nurse is assessing a patient with a suspected basilar skull fracture. Which finding is most consistent? Option A. Battle's sign, mastoid ecchymosis. Option B. Scalp laceration. Option C. Anterior neck hematoma. Option D. Depressed skull fracture. The correct answer is option C. Anterior neck hematoma. Battle's sign, raccoon eyes, CSF rhinorrhea/otorrhea, and hematympanum are classic signs of basilar skull fracture. In this rotation, C is the correct position. Question 16. The nurse administers a fluid bolus to a patient in shock. The CVP rises from 2 to 12 mmHg with little change in blood pressure. This indicates: Option A. The patient needs more fluids. Option B. The patient is fluid responsive. Option C. Poor cardiac function, fluid is not being pumped effectively. Option D. Normal response. The correct answer is option A. The patient needs more fluids. A significant rise in CVP without improvement in BP suggests the heart cannot handle the volume, indicating pump failure. In this rotation, A is the correct position. Question 17. A patient with adrenal crisis presents with: Option A. Hypertension and hyperglycemia. Option B. Hypotension, hyponatremia, hyperkalemia, and hypoglycemia. Option C. Hypocalcemia and hypophosphatemia. Option D. Polyuria and polydipsia. The correct answer is option B. Hypotension, hyponatremia, hyperkalemia, and hypoglycemia. Adrenal crisis causes mineralocorticoid and glucocorticoid deficiency, hypotension, hyponatremia, hyperkalemia, and hypoglycemia. Question 18. A patient with myasthenia gravis presents with ptosis, diplopia, and progressive weakness. These symptoms are due to: Option A. Demyelination of central nerves. Option B. Destruction of dopamine-producing neurons. Option C. Antibodies against acetylcholine receptors at the neuromuscular junction. Option D. Compression of the spinal cord. The correct answer is option C. Antibodies against acetylcholine receptors at the neuromuscular junction. MG is an autoimmune disorder where antibodies block or destroy acetylcholine receptors, impairing neuromuscular transmission. Question 19. A patient with chronic COPD and CO2 retention presents with dyspnea. The nurse understands the primary respiratory drive may be: Option A. Elevated PaCO2. Option B. Low PaO2, hypoxic drive. Option C. Increased pH. Option D. Elevated HCO3. The correct answer is option C. Increased pH. Some chronic CO2 retainers rely on the hypoxic drive. Oxygen should be titrated to SpO2 88 to 92%. In this rotation, C is the correct position. Question 20. A patient with cirrhosis and ascites develops spontaneous bacterial peritonitis. The hallmark sign is: Option A. Painless abdominal distension. Option B. Abdominal pain with rebound tenderness and fever. Option C. Visible peristalsis. Option D. borborygmi. The correct answer is option C. Visible peristalsis. SBP presents with abdominal pain, fever, and peritoneal signs in a patient with ascites. In this rotation, C is the correct position. Question 21. A patient with sepsis has a lactate of 5.2 mol/L and remains hypotensive after 30 ml/kg crystalloid. The nurse should anticipate: Option A. More fluids only. Option B. Initiation of norepinephrine and reassessment of fluid responsiveness. Option C. Discharge. Option D. Observation only. The correct answer is option B. Initiation of norepinephrine and reassessment of fluid responsiveness. Persistent hypotension after adequate fluids requires vasopressors. Norepinephrine is first line. Question 22. A patient has a pulse oximetry reading of 80% that does not improve with supplemental oxygen. The patient's skin is pink and warm. The nurse suspects: Option A. True hypoxemia. Option B. Carbon monoxide poisoning. Option C. Methemoglobinemia. Option D, anemia. The correct answer is option B, carbon monoxide poisoning. Carbon monoxide poisoning causes falsely elevated or normal appearing SpO2 and a cherry red skin color despite severe tissue hypoxia. Question 23. Under the Emergency Medical Treatment and Active Labor Act, EMTALA, a medical screening exam must be provided to Option A, patients with private insurance only. Option B, any person who comes to the ED and requests care. Option C, U.S. citizens only. Option D, patients with urgent conditions only. The correct answer is option D, patients with urgent conditions only. EMTALA mandates a medical screening exam for any individual presenting to a Medicare participating ED, regardless of ability to pay. In this rotation, D is the correct position. Question 24. The most common symptom of acute MI in elderly women is Option A, crushing chest pain. Option B, dyspnea and fatigue. Option C, left arm pain. Option D, jaw pain. The correct answer is option D, jaw pain. Elderly women often present with atypical symptoms such as dyspnea and fatigue rather than classic chest pain. In this rotation, D is the correct position. Question 25. A patient with acute pancreatitis has hypocalcemia. The nurse expects which physical finding? Option A, muscle weakness. Option B, Trousseau's sign, carpal spasm with BP cuff inflation. Option C, hyperreflexia. Option D, bradycardia. The correct answer is option B, Trousseau's sign, carpal spasm with BP cuff inflation. Hypocalcemia causes neuromuscular irritability, Trousseau's sign, Kvostek's sign, and tetany. Question 26. A patient with a 45% TBSA partial thickness burn weighs 70 kilograms. Using the Parkland formula, the total fluid requirement in the first 24 hours is Option A, 6,300 ml. Option B, 12,600 ml. Option C, 18,900 ml. Option D, 25,200 ml. The correct answer is option C, 18,900 ml. 4 ml x 70 kg x 45% equals 12,600 ml in 24 hours. Half, 6,300 ml, is given in the first 8 hours. In this rotation, C is the correct position. Question 27. A patient with ethylene glycol, antifreeze, poisoning has Option A, normal anion gap acidosis. Option B, high anion gap metabolic acidosis with calcium oxalate crystals in urine. Option C, respiratory alkalosis. Option D, hypoglycemia. The correct answer is option C, respiratory alkalosis. Ethylene glycol causes high anion gap acidosis, oxalate crystalluria, and end organ damage. In this rotation, C is the correct position. Question 28. The most common location for hypertensive intracerebral hemorrhage is the Option A, cerebellum. Option B, pons. Option C, basal ganglia. Option D, frontal lobe. The correct answer is option C, basal ganglia. Hypertensive hemorrhages most commonly occur in the basal ganglia, thalamus, pons, and cerebellum. Question 29. A patient with known alcoholic liver disease presents with confusion, asterixis, and fater hepaticus. The nurse suspects Option A, hepatic encephalopathy. Option B, Wernicke's encephalopathy. Option C, acute alcohol withdrawal. Option D, subdural hematoma. The correct answer is option A. Hepatic encephalopathy. The triad of confusion, asterixis, flapping tremor, and phater hepaticus, musty breath odor, is classic for hepatic encephalopathy. Question 30. A patient with severe flank pain has a positive urine pregnancy test. The nurse's next priority is: Option A, administer pain medication and obtain renal imaging. Option B, discharge with follow-up. Option C, rule out ectopic pregnancy with ultrasound. Option D, administer antibiotics. The correct answer is option B. Discharge with follow-up. Ectopic pregnancy must be ruled out first in a pregnant patient with pain, even if symptoms suggest renal colic. In this rotation, B is the correct position. Question 31. The antidote for cyanide poisoning is: Option A, naloxone. Option B, hydroxycobalamin, cyanoacate, or sodium thiosulfate. Option C, atropine. Option D, N-acetylcysteine. The correct answer is option D, N-acetylcysteine. Hydroxycobalamin binds cyanide directly. Sodium thiosulfate enhances endogenous detoxification. In this rotation, D is the correct position. Question 32. Which of the following is a classic presentation of Cushing's syndrome? Option A, weight loss and hyperpigmentation. Option B, central obesity, moon face, buffalo hump, and striae. Option C, exophthalmos and goiter. Option D, hypothermia and bradycardia. The correct answer is option D, hypothermia and bradycardia. Cushing's syndrome from excess cortisol causes central obesity, moon facies, supraclavicular fat pad, and purple striae. In this rotation, D is the correct position. Question 33. A patient with diabetes insipidus produces urine with which specific gravity? Option A, greater than 1.030. Option B, less than 1.005. Option C, 1.010 to 1.020. Option D, variable, but typically normal. The correct answer is option D, variable, but typically normal. DIC causes inability to concentrate urine, resulting in very dilute urine, specific gravity 1.005. In this rotation, D is the correct position. Question 34. The normal intracranial pressure, ICP, range for an adult is: Option A, 0 to 5 mmHg. Option B, 5 to 15 mmHg. Option C, 15 to 25 mmHg. Option D, 25 to 35 mmHg. The correct answer is option C, 15 to 25 mmHg. Normal ICP is 5 to 15 mmHg. Sustained ICP above 20 mmHg is considered pathological and requires treatment. In this rotation, C is the correct position. Question 35. Which diagnostic test is the gold standard for confirming acute appendicitis? Option A, abdominal X-ray. Option B, abdominal ultrasound. Option C, CT scan of the abdomen with 4 contrast. Option D, complete blood count. The correct answer is option A, abdominal X-ray. CT scan is the most accurate imaging modality for appendicitis, though ultrasound is often initial in children and pregnant patients. In this rotation, A is the correct position. Question 36. A patient with a traumatic brain injury develops diabetes insipidus. The nurse would expect: Option A, decreased urine output and concentrated urine. Option B, polyuria with dilute urine and hypernatremia. Option C, oliguria and hypotension. Option D, hematuria and flank pain. The correct answer is option B. Polyuria with dilute urine and hypernatremia. Diabetes insipidus causes massive diuresis of dilute urine, leading to hypernatremia and hypovolemia. Question 37. A patient with a pulmonary contusion is at highest risk for developing. Option A, pneumothorax. Option B, acute respiratory distress syndrome, ARDS. Option C, pneumonia. Option D, pleural effusion. The correct answer is option B. Acute respiratory distress syndrome, ARDS. Pulmonary contusion causes inflammation and capillary leak, which can progress to ARDS over 24 to 48 hours. Question 38. The nurse is assessing a patient with a suspected basilar skull fracture. Which finding requires immediate notification? Option A, scalp laceration. Option B, clear nasal drainage testing positive for glucose. Option C, headache. Option D, nausea. The correct answer is option D. Nausea. Glucose positive clear nasal drainage indicates CSF leak, requiring neurosurgical evaluation. In this rotation, D is the correct position. Question 39. Which of the following is a sign of an acute ischemic stroke? Option A, gradual onset of headache over weeks. Option B, sudden onset of facial droop, arm weakness, and speech difficulty. Option C, progressive memory loss over months. Option D, fever and stiff neck. The correct answer is option C. Progressive memory loss over months. Acute ischemic stroke presents with sudden onset of focal neurological deficits. In this rotation, C is the correct position. Question 40. The maximum safe rate for 4-potassium administration is typically. Option A, 10 milliequivalent/hour via peripheral line. Option B, 40 milliequivalent/hour. Option C, 100 milliequivalent/hour. Option D. No maximum exists. The correct answer is option B. 40 milliequivalent/hour. Potassium is usually infused at 10 milliequivalent/hour via peripheral line, up to 20 milliequivalent/hour with central access and cardiac monitoring. In this rotation, B is the correct position. Question 41. A patient with hypokalemia is at increased risk for. Option A, deep vein thrombosis. Option B, cardiac dysrhythmias. Option C, seizures. Option D, pulmonary edema. The correct answer is option A. Deep vein thrombosis. Hypokalemia predisposes to cardiac dysrhythmias, particularly in patients taking digoxin. In this rotation, A is the correct position. Question 42. A patient with traumatic brain injury exhibits decerebrate posturing. This indicates damage to the. Option A, cerebral cortex. Option B, midbrain or brainstem. Option C, cerebellum. Option D, spinal cord. The correct answer is option C. Cerebellum. Decerebrate posturing indicates brainstem damage below the red nucleus and carries a poorer prognosis. In this rotation, C is the correct position. Question 43. A patient receiving thrombolytic therapy develops angioedema. The nurse should. Option A, continue the infusion. Option B, stop the infusion and manage the airway. Option C, administer more thrombolytics. Option D, administer antihypertensives. The correct answer is option C. Administer more thrombolytics. Angioedema is a serious allergic reaction. The infusion should be stopped and airway management prioritized. In this rotation, C is the correct position. Question 44. Which of the following is a classic sign of hypocalcemia? Option A, Kvostek's sign and Trousseau's sign. Option B, muscle weakness and hyporeflexia. Option C, bradycardia. Option D, polyuria. The correct answer is option C, bradycardia. Kvostek's sign, facial twitch with tapping, and Trousseau's sign, carpal spasm with BP cuff, indicate hypocalcemia. In this rotation, C is the correct position. Question 45. The antidotes for ethylene glycol or methanol poisoning are: Option A, naloxone and atropine. Option B, fompazole or ethanol. Option C, N-acetylcysteine. Option D, sodium bicarbonate. The correct answer is option D, sodium bicarbonate. Fompazole, preferred, and ethanol inhibit alcohol dehydrogenase, preventing formation of toxic metabolites. In this rotation, D is the correct position. Question 46. A patient presents with sudden pleuritic chest pain, dyspnea, absent breath sounds on the right, tracheal deviation to the left, and hyperresonance. Priority intervention is: Option A, obtain stat chest X-ray. Option B, needle decompression at right second intercostal space. Option C, administer albuterol nebulizer. Option D, prepare for endotracheal intubation. The correct answer is option C, administer albuterol nebulizer. Tension pneumothorax requires immediate needle decompression. In this rotation, C is the correct position. Question 47. The appropriate aspirin dose for suspected ACS is: Option A, 162 to 325 mg chewable, non-enteric coated. Option B, 81 mg chewable. Option C, 650 mg enteric coated. Option D, 1000 mg rectal. The correct answer is option A, 162 to 325 mg chewable, non-enteric coated. 162 to 325 mg of non-enteric coated, chewable aspirin should be given as soon as possible. Question 48. Which of the following findings would the nurse expect in a patient with left hemispheric stroke? Option A, left-sided neglect. Option B, right-sided weakness and aphasia. Option C, impulsive behavior. Option D, visual spatial deficits. The correct answer is option A, left-sided neglect. Left hemisphere stroke typically causes right-sided motor deficits and language disturbances, aphasia. In this rotation, A is the correct position. Question 49. The most common cause of acute pelvic pain in women of reproductive age is: Option A, ovarian cancer. Option B, pelvic inflammatory disease. Option C, ectopic pregnancy. Option D, appendicitis. The correct answer is option C, ectopic pregnancy. PID is the most common cause, though ectopic pregnancy must always be ruled out first due to its life-threatening nature. Question 50. A patient with a history of bariatric surgery presents with abdominal pain, tachycardia, and fever. The nurse suspects: Option A, dumping syndrome. Option B, anastomotic leak. Option C, constipation. Option D, gallstones. The correct answer is option D, gallstones. Tachycardia, fever, and abdominal pain after bariatric surgery suggest anastomotic leak, a surgical emergency. In this rotation, D is the correct position. Question 51. The nurse is caring for a patient with a suspected compartment syndrome. The earliest sign is: Option A, absent pulses. Option B, pallor. Option C, pain out of proportion to injury and pain with passive stretch. Option D, paralysis. The correct answer is option A. Absent pulses. Severe pain disproportionate to findings and pain with passive stretch are the earliest and most reliable signs. In this rotation, A is the correct position. Question 52. A patient with a high-voltage electrical injury should have: Option A, outpatient management. Option B, cardiac monitoring for at least 24 hours. Option C, discharge after a normal ECG. Option D, no specific monitoring. The correct answer is option D, no specific monitoring. High-voltage injuries require cardiac monitoring due to risk of delayed dysrhythmias. In this rotation, D is the correct position. Question 53. Which antiarrhythmic is contraindicated in structural heart disease? Option A, flecainide. Option B, amiodarone. Option C, lidocaine. Option D, procainamide. The correct answer is option A, flecainide. Class IC antiarrhythmics like flecainide are contraindicated in structural heart disease due to increased mortality. Question 54. The treatment for cardiac tamponade is: Option A, fluid restriction. Option B, pericardiocentesis. Option C, beta blockers. Option D, observation. The correct answer is option A, fluid restriction. Pericardiocentesis, needle drainage of pericardial fluid, is the definitive emergency treatment. In this rotation, A is the correct position. Question 55. A patient with massive transfusion develops hypothermia, acidosis, and coagulopathy. This triad is known as: Option A, Beck's triad. Option B, the lethal triad, trauma triad of death. Option C, Cushing's triad. Option D, Firko's triad. The correct answer is option B, the lethal triad, trauma triad of death. Hypothermia, acidosis, and coagulopathy form a vicious cycle that worsens bleeding and mortality in trauma. Question 56. Which pupil finding is associated with uncal herniation? Option A, pinpoint, non-reactive pupils. Option B, unilaterally dilated and fixed pupil. Option C, bilateral mid-position and fixed pupils. Option D, constricted, sluggishly reactive pupils. The correct answer is option B, unilaterally dilated and fixed pupil. Uncal herniation compresses the ipsilateral oculomotor nerve, CN3, causing a unilateral dilated and fixed pupil. Question 57. A patient with a transfusion-related acute lung injury, TRLI, presents with: Option A, fever and rash. Option B, acute dyspnea, hypoxemia, and bilateral pulmonary edema within 6 hours of transfusion. Option C, hypertension. Option D, anaphylaxis. The correct answer is option A, fever and rash. TRLI is characterized by acute respiratory distress and non-cardiogenic pulmonary edema after transfusion. In this rotation, A is the correct position. Question 58. A patient with an acute asthma exacerbation has been receiving continuous albuterol for 2 hours. The nurse notes a tremor and heart rate of 120. The nurse should: Option A, stop the albuterol immediately. Option B, recognize these as expected side effects and continue monitoring. Option C, administer a beta blocker. Option D, call a code blue. The correct answer is option D, call a code blue. Tremor and tachycardia are expected side effects of beta agonist therapy and do not require discontinuation. In this rotation, D is the correct position. Question 59. A patient with cholecystitis has a positive Murphy's sign. To elicit this sign, the nurse palpates. Option A. The right upper quadrant during deep inspiration. Option B. The left lower quadrant during expiration. Option C. The epigastrium with the patient supine. Option D. The flank with percussion. The correct answer is option D. The flank with percussion. Murphy's sign is elicited by palpating the RUQ during inspiration, causing pain and inspiratory arrest. In this rotation, D is the correct position. Question 60. Which ABG finding would the nurse expect in a patient hyperventilating due to anxiety? Option A, pH 7.48, PaCO 230, HCO 324. Option B, pH 7.32, PaCO 250, HCO 324. Option C, pH 7.30, PaCO 230, HCO 318. Option D, pH 7.42, PaCO 240, HCO 324. The correct answer is option A, pH 7.48, PaCO 230, HCO 324. Acute respiratory alkalosis from hyperventilation, elevated pH, low PaCO2, normal HCO3. Question 61. SIRS, Systemic Inflammatory Response Syndrome, criteria include all of the following except: Option A, heart rate greater than 90 bpm. Option B, respiratory rate greater than 20 or PaCO 232 mmHg. Option C, temperature 38 degrees C or 36 degrees Celsius. Option D, elevated troponin. The correct answer is option D, elevated troponin. SIRS criteria include temperature, heart rate, respiratory rate, and WBC count abnormalities. Elevated troponin is not a SIRS criterion. Question 62. Which medication is a direct thrombin inhibitor used in PCI? Option A, heparin. Option B, bivalirudin. Option C, enoxaparin. Option D, warfarin. The correct answer is option B, bivalirudin. Bivalirudin is a direct thrombin inhibitor used as an alternative to heparin in PCI. Question 63. A patient with preeclampsia has which classic triad? Option A, hypotension, bradycardia, hypothermia. Option B, hypertension, proteinuria, edema. Option C, fever, cough, rhinorrhea. Option D, chest pain, diaphoresis, dyspnea. The correct answer is option D, chest pain, diaphoresis, dyspnea. The classic triad of preeclampsia is hypertension, proteinuria, and edema. In this rotation, D is the correct position. Question 64. The nurse is monitoring a patient for increased ICP. Which vital sign pattern is most concerning? Option A, tachycardia with hypotension. Option B, bradycardia with hypertension and irregular respirations, Cushing's triad. Option C, tachycardia with hypertension. Option D, normal vital signs. The correct answer is option B, bradycardia with hypertension and irregular respirations, Cushing's triad. Cushing's triad, bradycardia, hypertension, irregular respirations, is a late sign of increased ICP. Question 65. A patient with liver disease has an elevated INR and prolonged patient. The nurse understands this is due to: Option A, increased production of clotting factors. Option B, decreased production of clotting factors by the damaged liver. Option C, vitamin K excess. Option D, platelet dysfunction only. The correct answer is option B. Decreased production of clotting factors by the damaged liver. The liver produces most clotting factors. Liver damage impairs synthesis, leading to coagulopathy. Question 66. A patient with diabetic ketoacidosis has a potassium of 5.5 milliequivalent/L on admission. The nurse understands this is due to Option A, total body potassium excess. Option B, shift of potassium out of cells due to acidosis. Option C, renal failure. Option D, excess potassium intake. The correct answer is option C. Renal failure. Acidosis shifts potassium extracellularly, masking total body potassium depletion. Levels drop with insulin and fluid therapy. In this rotation, C is the correct position. Question 67. The safe harbor provision for nurses typically refers to Option A. A law that provides legal immunity in all circumstances. Option B. A process where a nurse can request peer review of an assignment they believe is unsafe without immediate fear of retaliation. Option C. A hospital policy allowing nurses to refuse any assignment. Option D. The requirement to report all medication errors. The correct answer is option D. The requirement to report all medication errors. Safe harbor laws allow nurses to accept an assignment but invoke review, providing some protection from retaliation. In this rotation, D is the correct position. Question 68. The initial treatment for a patient with an acute hemolytic transfusion reaction is Option A, slowing the transfusion rate. Option B, stopping the transfusion, aggressive for fluids, and diuretics to maintain urine output. Option C, administering antihistamines. Option D, continuing the transfusion at a slower rate. The correct answer is option A. Slowing the transfusion rate. Immediate cessation of the transfusion, fluid resuscitation, and maintaining urine output to prevent renal failure are critical. In this rotation, A is the correct position. Question 69. A patient with warm, flushed skin and bounding pulses in shock likely has Option A, hypovolemic shock. Option B, cardiogenic shock. Option C, distributive shock, early sepsis, neurogenic. Option D, obstructive shock. The correct answer is option A. Hypovolemic shock. Warm skin with bounding pulses suggests vasodilation, characteristic of distributive shock. In this rotation, A is the correct position. Question 70. The management of a patient with acute GI bleeding and hemodynamic instability includes Option A, oral fluids only. Option B, 2 large bore 4 lines, crystalloid infusion, and blood product resuscitation. Option C, immediate endoscopy before stabilization. Option D, observation only. The correct answer is option C. Immediate endoscopy before stabilization. Aggressive volume resuscitation with 4 fluids and blood products is the priority before endoscopy. In this rotation, C is the correct position. Question 71. A patient's systolic BP drops 15 mmHg during inspiration. This finding is Option A, pulsus alternans. Option B, pulsus paradoxus. Option C, pulsus bisferens. Option D, orthostatic hypotension. The correct answer is option B. Pulsus paradoxus. Pulsus paradoxus is an inspiratory fall in systolic BP greater than 10 mmHg. Question 72. A patient develops chest pain and hypotension 3 days post-ME with a new hollow systolic murmur at the LSB. The nurse suspects. Option A, ventricular septal rupture. Option B, acute mitral regurgitation. Option C, pericarditis. Option D, pulmonary embolism. The correct answer is option A. Ventricular septal rupture. A new loud hollow systolic murmur at the LSB post-ME suggests ventricular septal rupture. Question 73. The most common cause of intracerebral hemorrhage is Option A, aneurysm rupture. Option B, arteriovenous malformation. Option C, hypertension. Option D, amyloid angiopathy. The correct answer is option D. Amyloid angiopathy. Chronic hypertension is the most common cause of spontaneous intracerebral hemorrhage. In this rotation, D is the correct position. Question 74. A potential adverse effect specific to formoterone includes Option A, hypotension and bradycardia. Option B, pulmonary fibrosis. Option C, hepatotoxicity. Option D, corneal deposits. The correct answer is option A. Hypotension and bradycardia. Acute formoterone most commonly causes hypotension and bradycardia. Question 75. The priority patient for a trauma team activation based on mechanism of injury is Option A. An adult who fell from standing height. Option B. A pedestrian struck by a car traveling 15 miles per hour. Option C. An adult ejected from a vehicle. Option D. An adult with a gunshot wound to the forearm. The correct answer is option A. An adult who fell from standing height. Ejection from a motor vehicle is a high-risk mechanism warranting trauma team activation. In this rotation, A is the correct position. Question 76. Which ECG finding is most characteristic of severe hyperkalemia? Option A, peak T waves and widened QRS. Option B, prolonged QT interval. Option C, ST depression. Option D, U waves. The correct answer is option D. U waves. Severe hyperkalemia causes peak T waves, loss of P waves, widened QRS, and ultimately sine wave pattern. In this rotation, D is the correct position. Question 77. A patient with a history of substance abuse is in severe pain. The nurse should Option A, withhold pain medication due to addiction history. Option B, assess pain and administer appropriate analgesics as ordered. Option C, administer placebo. Option D, tell the patient to tolerate the pain. The correct answer is option B. Assess pain and administer appropriate analgesics as ordered. Pain should be treated appropriately regardless of addiction history. Undertreatment of pain is unethical. Question 78. A patient with severe hypothyroidism may have which cardiovascular finding? Option A, tachycardia. Option B, bradycardia and pericardial effusion. Option C, hypertension. Option D, bounding pulses. The correct answer is option B. Bradycardia and pericardial effusion. Hypothyroidism causes bradycardia, low cardiac output, and can cause pericardial effusion. Question 79. Diffuse ST elevation in all leads except AVR with PR depression is consistent with Option A, acute STEMI. Option B, acute pericarditis. Option C, early repolarization. Option D, left ventricular aneurysm. The correct answer is option D, left ventricular aneurysm. Diffuse ST elevation across multiple territories with PR depression is classic for acute pericarditis. In this rotation, D is the correct position. Question 80. The most common cause of death in the first 24 hours after acute MI is: Option A, ventricular fibrillation. Option B, cardiogenic shock. Option C, cardiac tamponade. Option D, papillary muscle rupture. The correct answer is option A, ventricular fibrillation. VF is the most common cause of death in the immediate post-MI period. Question 81. A patient with anaphylactic shock has which characteristic hemodynamic profile? Option A, high SVR and low CO. Option B, low SVR and variable CO with distributive physiology. Option C, normal SVR and low CO. Option D, high SVR and high CO. The correct answer is option C, normal SVR and low CO. Anaphylaxis causes vasodilation, low SVR, and increased capillary permeability, with CO that may initially be normal or increased. In this rotation, C is the correct position. Question 82. The Tensilin, edrophonium, test is used to diagnose: Option A, multiple sclerosis. Option B, myasthenia gravis. Option C, Guillain-Barré syndrome. Option D, Parkinson's disease. The correct answer is option D, Parkinson's disease. The Tensilin test involves administering edrophonium, which temporarily improves muscle strength in MG. In this rotation, D is the correct position. Question 83. A patient with severe sepsis has a SVO2 of 55%. This indicates: Option A, adequate oxygen delivery. Option B, inadequate oxygen delivery or increased oxygen extraction. Option C, hyperoxia. Option D, normal tissue perfusion. The correct answer is option B, inadequate oxygen delivery or increased oxygen extraction. Normal SVO2 is 60 to 80%. Low SVO2 indicates increased oxygen extraction due to inadequate delivery, typical in low-flow states. Question 84. A patient presents with SLUDGEM symptoms: salivation, lacrimation, urination, defecation, GI upset, emesis, and meiosis. This toxidrome is caused by: Option A, anticholinergics. Option B, sympathomimetics. Option C, cholinergics, organophosphates. Option D, opioids. The correct answer is option D, opioids. The SLUDGEM presentation is the cholinergic toxidrome, caused by organophosphate or carbamate poisoning. In this rotation, D is the correct position. Question 85. A patient with an epidural hematoma classically presents with: Option A, a lucid interval followed by rapid deterioration. Option B, progressive decline over days to weeks. Option C, gradual onset of headache. Option D, no loss of consciousness. The correct answer is option D, no loss of consciousness. Epidural hematoma often presents with a lucid interval initial loss of consciousness, then awake and alert, followed by rapid deterioration. In this rotation, D is the correct position. Question 86. A patient with increased ICP should be positioned with the head: Option A, flat to maximize cerebral perfusion. Option B, elevated 30 degrees in midline position. Option C, turned to the side to prevent aspiration. Option D, in Trendelenburg position. The correct answer is option B, elevated 30 degrees in midline position. Head elevation to 30 degrees with neutral alignment promotes venous drainage and reduces ICP. Question 87. The nurse is performing a neurological assessment. The patient is able to open eyes to verbal command, is confused but converses, and localizes pain. The GCS score is Option A 8, Option B 10, Option C 12, Option D 14. The correct answer is Option A 8. Eye opening to verbal, 3, confused verbal, 4, localizes pain, 5, equals GCS 12. In this rotation, A is the correct position. Question 88. A patient with bacterial meningitis should be placed on Option A standard precautions only, Option B droplet precautions, Option C airborne precautions, Option D contact precautions. The correct answer is Option D, contact precautions. Meningococcal meningitis requires droplet precautions. In this rotation, D is the correct position. Question 89. A patient with increased ICP should have which intervention avoided? Option A head elevation 30 degrees. Option B endotracheal suctioning unless absolutely necessary. Option C maintaining normothermia. Option D sedation as ordered. The correct answer is Option D, sedation as ordered. Suctioning increases ICP. It should be minimized and performed only when necessary with pre-oxygenation. In this rotation, D is the correct position. Question 90. The drug of choice for managing hypertension in a patient with a pheochromocytoma is Option A beta blockers alone, Option B phenoxybenzamine, alpha blocker, Option C ACE inhibitors, Option D diuretics. The correct answer is Option A, beta blockers alone. Alpha blockade with phenoxybenzamine or phentolamine is the primary treatment. In this rotation, A is the correct position. Question 91. A patient with a psychiatric emergency has homicidal ideation. The nurse's priority is Option A allow the patient to leave if they want. Option B ensure safety of the patient, staff, and others, initiate psychiatric hold protocols. Option C administer medications without consent. Option D ignore the statements. The correct answer is Option B. Ensure safety of the patient, staff, and others, initiate psychiatric hold protocols. Homicidal ideation requires immediate safety measures, including possible involuntary hold. Question 92. A patient with a spinal cord injury at T1 is bradycardic and hypotensive with warm, dry skin. This is characteristic of Option A hemorrhagic shock, Option B cardiogenic shock, Option C neurogenic shock, Option D septic shock. The correct answer is Option C, neurogenic shock. Loss of sympathetic innervation in neurogenic shock causes vasodilation, hypotension, and unopposed parasympathetic activity, bradycardia, with warm skin below the injury. Question 93. A patient with esophageal perforation, Barré-Have syndrome, classically presents with Option A gradual onset of dysphagia, Option B severe chest pain and subcutaneous emphysema after forceful vomiting, Option C chronic heartburn, Option D painless hematemesis. The correct answer is Option B, severe chest pain and subcutaneous emphysema after forceful vomiting. Barré-Have syndrome is spontaneous esophageal rupture from forceful vomiting, causing severe chest pain and subcutaneous emphysema. Question 94. Clear fluid draining from the nose of a head-injured patient tests positive for glucose. This indicates Option A, allergic rhinitis. Option B, nasal mucosal secretions. Option C, cerebrospinal fluid leak. Option D, sinusitis. The correct answer is option D, sinusitis. CSF contains glucose while normal nasal secretions do not. Glucose-positive clear drainage after trauma indicates a CSF leak. In this rotation, D is the correct position. Question 95. A pregnant patient at 32 weeks presents with vaginal bleeding and abdominal pain. The nurse's priority is Option A, pelvic examination. Option B, assess fetal heart tones and maternal vital signs. Option C, administer tocolytics. Option D, discharge with follow-up. The correct answer is option B. Assess fetal heart tones and maternal vital signs. Fetal and maternal assessment are priorities. Pelvic exam may be deferred until placenta previa is ruled out. Question 96. The nurse is caring for a patient with a chest tube. Continuous bubbling is noted in the water seal chamber. This indicates Option A, normal function. Option B, an air leak in the system or patient's lung. Option C, the lung has re-expanded. Option D, suction is too high. The correct answer is option C, the lung has re-expanded. Continuous bubbling in water seal indicates an air leak. Intermittent bubbling with exhalation is normal. In this rotation, C is the correct position. Question 97. The emergency nurse suspects acute epiglottitis in a patient presenting with Option A, inspiratory stridor, drooling, and tripod positioning. Option B, barking cough, low-grade fever, and hoarseness. Option C, productive cough, pleuritic pain, and fever. Option D, wheezing, prolonged expiration, and accessory muscle use. The correct answer is option A. Inspiratory stridor, drooling, and tripod positioning. The classic triad of epiglottitis includes inspiratory stridor, drooling, and tripod positioning. Question 98. A patient with a black widow spider bite presents with Option A, localized tissue necrosis. Option B, severe muscle cramps, abdominal rigidity, and hypertension. Option C, hemorrhage. Option D, ascending paralysis. The correct answer is option B. Severe muscle cramps, abdominal rigidity, and hypertension. Black widow venom, letrotoxin, causes neurotransmitter release, leading to severe muscle cramps and autonomic instability. Question 99. Which statement by a patient receiving nitroglycerin indicates a need for further teaching? Option A, I will sit or lie down when I take it. Option B, I can take up to 3 doses 5 minutes apart. Option C, I should call 911 if pain is not relieved after 1 dose. Option D, I can take it with sildenafil if needed. The correct answer is option A. I will sit or lie down when I take it. Nitrates combined with PDE5 inhibitors can cause life-threatening hypotension. In this rotation, A is the correct position. Question 100. The correct initial energy setting for biphasic synchronized cardioversion of unstable atrial flutter is Option A, 50 to 100 J. Option B, 120 to 200 J. Option C, 300 J. Option D, 360 J. The correct answer is option D, 360 J. Atrial flutter typically requires lower energy for cardioversion. In this rotation, D is the correct position.